Our Human Resource FY24 Health Insurance Benefit Options Meeting. It is July 17, 2023. The time is 10:32 a.m. I'm calling this meeting to order. In attendance are Commissioners Matari, Brooks, and Duncan. Are there any changes to the agenda? Nope. All right, so we have a little bit of a housekeeping item, number one, that's not actually related to our health insurance information, but we had to get it on a meeting. It's ITD's requesting permission to access private property, so it's county-owned property for their I-90 corridor study, and it's between State Highway 41 and 15th Street in Coeur d'Alene. And you guys aren't going to be able to see this, but it's this teensy little thing here. So it's just a housekeeping thing, and it just ask for permission. So we've got, it's actually two parcels, and I'm just looking for any concerns, or you can authorize the chairman to sign the permission for them to access our property.
I say go ahead and sign it.
Okay.
Yep, go for it.
All right, motion.
I move that we approve the ITT request permission to access private property that's owned by Kootenai County by the I-90 corridor study, State Highway 41 to 15th Street.
I second the motion.
Bill Brooks.
Aye.
Commissioner Matari.
Aye.
Chair Duncan.
Aye, thank you. And now item 2, while we are really here, FY24 Health Insurance Benefit Options with our Alliant partners and employee benefits. So, Scott?
Great. Thank you. Scott Burkhart with Alliant, David Smith with Alliant, Coco Brockhoff with Alliant, and Todd Fouché with PMR Healthcare in attendance here. So David's going to start off with the budget, and then we'll get into some recommendations.
Okay. Just a reminder, the budget is October through September, so we do the fiscal year budget in these meetings. I always like to clarify that because he's recorded, and there's a separate, the budget that goes January through December, which is when the rates are set. So when we look at the budget, what we have so far through 8 months of time, which is through May, I did not have June data yet when we kind of prepared this. The projected expense was about $8,300,000. We're at about almost $7.8 million, which is a surplus of about $540,000. So we're running quite well to budget so far this year. It does tend to worsen towards the end of the year, so I wouldn't get that $500,000 as an expected finish. The finish will probably be closer, based on historical patterns, closer to about $200,000 gain, but we're still running what should be a surplus in the time frame from what we budgeted. The reason for that, to give some idea, is the budget is, we have the line item expenses that we think we're going to incur, and they're always guesstimates. You're guessing what the future is going to be, especially with healthcare and different things. And we're also projecting what the cost is going to be, how many employees are there going to be. And so the employees that we had projected for the year, we've had less than that. So we haven't had the growth, and that's kind of really been the biggest contributor to the fact that we have a surplus. So if we look at 2024, what are we suggesting that you might experience for October of 2023 through September 2024, which is the 2024 fiscal year? We're really saying no increase to the budget. You can see on the medical employees, on most of those employee categories, we're not saying any growth, and that's growth from budget. That actually does represent some slight growth from what we currently have. Because like I said, we're under the budget on the employee count, which is contributing to that. And then if you look at the total expenses, we're looking that we're going to be almost dead on in the future year with what we had projected for this year. Some of the things that contribute to that we're not showing in there, medical trend is about 8% that we're applying to the medical claims. A lot of that's going to be on the hospital side because hospitals are really looking for bigger increases this year nationwide. Because they experienced a lot of losses during COVID, and so we're seeing that pressure. We're seeing some help on the pharmacy side, some improvement on the pharmacy rebates. That's kind of helping to offset that a little bit. We're looking at lower single-digit trends on the vision and dental, which has been pretty consistent for about the last 3 or 4 years. And there has been some movement from the Delta Dental plan to the Willamette Dental plan. The Delta Dental is a self-funded plan, and the Willamette Dental is a fully insured plan, but it controls the cost a little bit differently. And so I think that's had some positive impacts as well. And so overall, we're looking at basically a flat budget from this year to next year.
Great. Okay, just a little history on the actual renewal decisions relative to the employees. So we've had no increases to employee contributions in 4 years, which is awesome. Pretty much the trend during COVID, most employers were holding pat, but since then, there have been, some increases. But Kootenai County has held no increases and no changes to benefits, deductibles, coinsurance, anything like that for 4 years. So great news. We also added Edison Centers of Excellence Tourism last year, and that's a great program. We know the concept's great. It'll take a little time for awareness and such, but we do see that as a valuable program as we go forward. So the 2024 recommendations are with a 0% increase. We're not recommending any changes to employee contributions or the core benefit levels. Now, some things that we do recommend, of course, the top one has already been agreed upon and done and in progress, is a change of benefit administration systems from Plan Source to Employee Navigator. The Plan Source contract terminates 9/17/23. And the go live for the Ben admin system on Navigator is 9/1. There's about $50,000 annual savings in that for the county. We've also, one of the main reasons we are leaving Plan Source is service. Their service model kind of failed us the last couple of years, and with Navigator, we're actually going to have 2 dedicated service reps. One with Aflac, as we'll talk about here in a second, but we've also, Alliant has a license for Navigator, so we're going to have both of them team up. It'll be real-time customer service for the administration on Navigator, and a better platform overall, we think. So we are also recommending a change of 3 of the voluntary products to Aflac, accident, critical illness, and hospital. There's comparable cost and benefits, but along with the Navigator platform and the brand name value recognition, we think it's a great change to make. We do recommend keeping the voluntary life and short-term disability with standard because that's who our core products are with, and there's coordination on those. So all of that will be explained, communicated to employees, and we think the Aflac is a great opportunity for the county to add benefits, add brand name recognition. There's proactive, personal level service from the Aflac representatives, whereas our past program is more passive in nature. But you'll get a lot of value and enhancement across the benefit spectrum overall with a dedicated service. And then the recommendation is implement the PMR primary care clinic. We decided at the April board meeting to proceed, assuming that there was a reasonable trend with their updated proposal. And while there is a cost increase of about 11%, that represents an 18-month gap from when their last proposal was to this. And in the current era of hyperinflation, 8% annual trend, 11% over 18 months is within those norms. So, but even with that cost increase, we're still recommending budget neutral. So everything David talked about up front is where we land, even with implementing PMR. The impact of PMR is going to be, obviously, it's going to depend on utilization, timing of when we implement, and such. But everything we're talking about today is really geared towards a 1/1 start date, which is then only 3/4 of a budget year. But we're still saying budget neutral is the way to go. So this is just a comparison of where we were with their initial proposal 18 months ago. And I broke it out further this time here at your request. So the one-time setup fee of $250,000, that went up slightly to $255,000, and included in that is $125,000 for clinic build-out. Okay. And then the ongoing annual cost, which is the majority, that's where much of the trend kicked in. And then our fee, no change in what was included in the proposal. So went from 1.35 to 1.5 million. And we think this is, over the next 3 to 5 years, the best investment Kootenai County can make in terms of benefits offered, additional benefits offered, in terms of cost management, in terms of employment, recruitment, retention. We don't see another better investment on the horizon than the near-site clinic. So just a reminder, we're saying budget neutral, okay? But PMR's proposal, in looking at the actual data, they believe that there could actually be in the first year $750,000 of savings. Okay, over 5 years, 580,000. Now, Todd,
5.8 million.
or 5, excuse me, yeah, 5.8 million. And we went in depth, and we can validate their methodology on how they arrive at this, but we want to be ultra conservative because there's a lot of variables, and we don't want to overshoot the mark on this. We'll see these results over time. We're confident, but how much is in the first year? We don't know for sure. Okay. The tremendous member benefit, greatly enhanced provider access, no member deductibles out of pocket, a lot of RXs dispensed in the clinic, and we think there's a huge opportunity in the mental health space as well with the primary care entry point of PMR, and then steerage guidance to appropriate quality cost, specialty services and hospital services. And then this is just a slide of that the projected ROI from PMR that we just referenced. So, and with that, that's really our presentation. And if there's any questions, Todd from PMR offered to come and show support, answer any final questions that you might have. Yeah, so.
So the 125,000 setup, is it possible that if we found a location that was already set up, then that would be a savings? If you push your little button, right? Yeah, you can just leave it right there, but thank you.
I always like to stay open to any way we can reduce the cost. The setup includes like the exam tables, the lighting, the recruitment of the providers, the communication campaign to the employees is all wrote into that. So I just have to get a real sense of what that means in terms of what would be available possibly. But any effort we can make to reduce the cost certainly would be there. But that gives you an idea of what's in that number.
Okay.
But, yeah.
Leslie, just further on that, PMR's actual, what you're going to pay them is, I believe, 130,000. Okay, that's what all the things that
Set
Todd
up
had
on
just
our side.
referenced. We included another 125,000
For your build-out.
for construction, for build out. So to your
Okay.
point, it
Thank you
could
for-
potentially be in there if you've got a clinic ready to go.
Yes.
Yes, but in the tours that we did in those other facilities, I can't recall the gentleman's name, but the architect, he said the cost to build out one of those facilities could be 50 to 200,000, right? So we went in the middle.
Yeah.
And to your point, if we find something that's ready to go, yes, that number could be lower. But theirs is a fixed fee to stock, et cetera, and that's contractual that you would pay them I think it's 130,000.
Okay, great. So I will say that the facilities working group met this morning and have identified at least 3 locations to look at leasing in the hospital corridor. And one of those locations is currently scheduled to undergo renovation. So if they had a client who came in and could tell them how to renovate it, then we may be saving that money.
Great.
So that's kind of exciting news. So somebody will reach out to HR and get you a tour over there when the time's appropriate. But yeah, we're still looking at that. We've kind of exhausted all county-owned facilities at this point. So we're kind of looking to go out and see what the cost would be to lease right in that hospital corridor. So if the person needs to go on to emergency room, they'll be, located pretty closely. So centrally located for all of our county facilities and stuff. So that's kind of the exciting news now, and I can't give any more details since we're dealing with private entities on that end of it, but.
Leslie, I had reached out to a commercial realtor. Do you want me to hold off right now with any, having them look for space?
That's a good question. Greg was in the meeting this morning. I mean, is there,
Nothing's set in stone with Corey right now, so it wouldn't hurt to keep looking.
yeah, so I guess continue down that path. But hopefully we'll, get you a tour sooner than later on that one particular location that's being renovated. And so, yep. So, any other questions?
No, I think looking outside for at least a couple years until the Justice Center is completed and we have this big shuffling of all of the employees is prudent. And if it's already built out or will be built out to the specs, paint and carpet. And that saves us a lot of money.
Yeah, does. Bill, thoughts?
Always when you have a medical, no matter how low-level medical care you're providing, it's a lot more expensive than just a regular room.
Sure.
I've done it before. And so it's important to just remember that it's, I would like to say, like Bruce said, and I think it's a very good paint and carpet, but there's, it makes me nervous. I've done it, and I know it can be done, and places can be found. Obviously, my big bugaboo is that it's accessible,
Sure. Yeah.
good accessible. The worst accessible place in this county is the Coeur d'Alene Press front door.
Yeah.
Okay. So at this point, anything else for us?
No, just, I think we need a final decision on the PMR implementation and everything, and then the 3 Aflac voluntary products, and I think everything else was, yeah.
Okay. And so that would be considered under our options on the agenda. So any further discussion on anything presented today?
No, I think it all makes sense and it's a good pathway moving forward.
Okay.
I like it, and every year you come back, I hold my breath. So far, you've done a great job. I'm just waiting for 1 year you come back and go, sorry, it's going to be 400% more. So I know you shop carefully, and I appreciate that on behalf of the people of the county.
Okay.
Thank you.
Motion?
I move that we approve the FY24 health insurance benefit options with the Alliant employee benefits.
I second the motion.
Bill Brooks,
Aye.
Commissioner Matari,
Aye.
Chair Duncan.
Aye. All right. Public comment? Hearing none? All right, 10:50, meeting adjourned. Thank you.
Thank you.